Every 2 seconds, somewhere in the world, someone receives a blood transfusion. Right now. In a hospital, in an emergency department, in an operating room. And at that very moment, doctors have only one question in mind. What is this patient's blood type and Rh factor? Because a mistake with blood type is not a complication or a side effect. It is an incompatibility that can cost a life within minutes. This is an important parameter that directly determines whether this blood can be transfused and whether the body can withstand it. Imagine that the world of blood groups is a cookie. In the store, there are cookies with different additions, flavors, and combinations. At first glance, they may look similar, but if you look closer, each cookie is unique. Blood groups are the same. There are only 4, but each one has its own special characteristics. Let's get to know them through cookies. It will be easier and tastier this way. Blood group O, a plain cookie. This is the simplest cookie. No chocolate, no nuts, just the base. Blood group O is similar. It has no extra add-ons, which is why it is often called universal. It is simple, clear, and serves as the foundation for all the others. Blood group A, a chocolate chip cookie. This is no longer just a cookie, but one with a pleasant addition, chocolate chips. Blood group A is similar because it has one special element added. It is softer in character and stands out from the plain cookie thanks to this new flavor. Blood group B, a cookie with nuts. Here, instead of chocolate, there are nuts. The taste is different, richer and more distinctive. Blood group B is also a cookie with an add-on, but its own unique one. It is not like A. It has its own recipe. Blood group AB, a cookie with chocolate chips and nuts. This is the most loaded cookie, both chocolate chips and nuts together. Blood group AB combines everything at once. It brings together the qualities of blood group A and blood group B, the rarest but the richest option. What if your blood type was a cookie and a drink? The cookie represents your blood group and the drink represents your Rh factor. And depending on what kind of cookie you have and what's in your glass, it determines who you can share your blood with, who you can receive blood from, and in which situations you become irreplaceable. Blood group O, the plain cookie. And that's exactly why almost everyone can eat it. O negative, plain cookie plus water. This is the universal soldier of medicine. Prevalence, only about 6 to 7% of the population. Rare. And that's what makes it so valuable. Transfusion, can be given to any blood group, can receive blood only from O negative. This is the blood of emergencies. Car accidents, trauma, massive bleeding. When there's no time to test, no time to ask questions, and decisions must be made immediately. Minimum antigens, minimum risk of immune reaction. Unique traits and tendencies. Statistically lower risk of blood clots and thrombosis, slightly lower risk of heart disease, but higher sensitivity to severe blood loss because there is no backup donor group O positive. Plain cookie plus water with sugar. Still simple, but with a little more flavor. Prevalence, one of the most common blood types in the world, up to 35 to 40% in some populations. Transfusion, can be given to all positive groups, cannot be given to negative patients, can receive blood from O negative and O positive. This is the workhorse of hospitals. Not a legend, but the backbone of everyday transfusion medicine. Unique traits and tendencies. Generally good resistance to infections, slightly higher risk of stomach and duodenal ulcers, increased susceptibility to Helicobacter pylori infections. Blood group A, cookie with chocolate chips. Chocolate represents antigen A. It adds flavor, but immediately limits compatibility. A negative, chocolate chip cookie plus water. A calm and precise combination. Prevalence, about 5 to 6% of the population. Transfusion, can donate to A negative and AB negative, can receive blood only from O negative and A negative. This blood is valued for its predictability, often used in planned transfusions, hematology, and patients with chronic conditions where immune reactions must be avoided. Unique traits and tendencies. Statistically higher risk of autoimmune conditions, slightly increased risk of iron deficiency anemia. higher sensitivity to chronic stress and inflammation. A positive. Chocolate chip cookie plus sweet tea. One of the most recognizable combinations. Prevalence. Up to 30 to 35% of the population. Transfusion. Can donate to A positive and AB positive can receive from O negative, O positive, A negative, A positive. Not compatible with blood group B or AB negative. This blood forms the foundation of surgery and internal medicine. Not universal, but extremely reliable. Unique traits and tendencies. Increased risk of cardiovascular disease compared to group O, slightly higher risk of gastric cancer. Stronger tendency toward elevated cortisol levels under stress. Blood group B, cookie with nuts. Not everyone likes nuts, and not everyone is compatible with this blood group. B negative, nut cookie plus water. A rare and demanding type. Prevalence, around 1 to 2% of the population. Transfusion, can donate to B negative, and AB negative can receive only from O negative and B negative. This blood requires precision. It's used when there is time to plan, not guess. Unique traits and tendencies. Statistically higher risk of certain autoimmune disorders, increased sensitivity to metabolic imbalances, stronger reactions to incompatible transfusions. B positive, nut cookie plus juice, a more flexible version. Prevalence. About 8 to 10% of the population, higher in some Asian regions. Transfusion. Can donate to B positive and AB positive, can receive from O negative, O positive, B negative, B positive. Not universal, but essential in its own niche. Unique traits and tendencies. Slightly increased risk of type 2 diabetes higher. Likelihood of chronic inflammation markers, relatively strong adaptation to dietary changes. Blood group AB, cookie with chocolate and nuts, the most complex cookie, the most selective donor. A B negative, everything at once plus water, an extremely rare combination. Prevalence, less than 1% of the population. Transfusion, can donate only to AB negative, can receive from all negative groups. This blood appears in the most complex medical cases, where there is no room for error. Unique traits and tendencies. Higher risk of immune dysregulation, increased likelihood of rare autoimmune syndromes, extremely sensitive to transfusion mismatches. AB positive, everything at once, plus cocktail, the ultimate universal recipient. Prevalence, around 3 to 4% of the population. Transfusion, can receive blood from any group, can donate only to AB positive. Used in oncology, transplant medicine, and massive transfusions, where flexibility saves lives. Unique traits and tendencies. Highest statistical risk of cardiovascular disease among ABO groups, increased risk of cognitive decline and dementia in old-age immune system that tolerates much. Sometimes too much. So now imagine this not just as a metaphor, but as your cookie. What kind of cookie do you have? Is it a plain cookie? With chocolate, with nuts, or everything at once? Write it in the comments. Would you share your cookie if someone's life depended on it? And sometimes, the simplest choice is the one that matters most. The simpler the cookie, the more people you can save. The more complex the cookie, the more options you have to receive help. There are no better or worse blood types. Only different roles in a system where the price is human life.